Welcome, everyone. It's very nice to see you all again. Some faces are common, and it's very nice to have new participants as well. This is the Community of Practice for Advocates of Developmental Disability Services, which is a session we have launched a few months back under the IACD. Today we will be having this agenda under our discussion. We have our honorable guest speaker, Dr. Nana Nino Tatshivili, and she will make a speech on gaining political support for driving change and why that is important. And we will have a breakout group discussions on the topic and sharing experience among ourselves, and we will share what we have discussed within our group to the audience. And finally, we will have some questions, and then I will summarize for us. And I will put forward the plan for next community of practice sessions. So these are just the common ground rules that we follow. We will be happy if it's possible for you to keep your camera on. It's always nice to see your faces, and members of the community of practice are all professionals involved in and related to the service of children with developmental disability. And we want to emphasize that everyone's voice is important, and the information shared during this session is not official recommendations. And we will appreciate it if you could raise your hand virtually to speak, or you can use the chat box as well, whichever you prefer. So the IACD is the host of this session, and the GPEC team runs the community of practice sessions. These are just to introduce you the members of the community of practice team under the GPEC. And this is the reason why we started the community of practice sessions, and we know that there are principal barriers for not using services in many countries, and we want to address those barriers to be able to provide service to children with disabilities. So now I will briefly introduce our guest speaker, Dr. Nana Nino. Just give me a second because I'm using two screens. Just confusing me. So Dr. Nana Nino Tatishvili was born in Tbilisi, Georgia, and she is a professor of neurology, head of neuroscience department of the Central Children's Hospital. She is also the chair of neurology at Tbilisi Medical University, and she is the president of Georgian Association of Child Neurology and Neurosurgery. Dr. Nana has a very rich CV, so it's really hard to read through all her accomplishments. She's one of the founders of the Georgian LA and organizer and chair of scientific committee of Regional Caucasian Summer School on Clinical Epileptology. She is also the co-author of Fellowship Program for Neurology and Pediatric Neurology in Georgia. And she is the author of Residency Program in Pediatric Neurology and Competence of Pediatric Neurology in Georgia. She is an honorable member of editorial boards of journal Epileptology Facts and Controversy. She has received the European Epilepsy Education Award in 2016. And her clinical research interests include epilepsy, cerebral palsy, stroke, and neurodevelopmental disorders. And she's the author of 52 publications and 1 monograph. It's really an honor to have you here, Dr. Tatishvili. Now I'll stop sharing my screen and transfer the platform to you. Thank you.
Thank you, Selamanesh, for nice overview of my biography. And thank you all for inviting me to speak in the community of practice. And I will try shortly to speak about our successful projects and how can we found the support from the government. General data about Georgia, it's a very small country with population 3.7 million and 800,000 young people, and GPD per capita from last year was a little bit more than $5,000. Why we have from during last 10 years, we have 3 successful projects, and I will shortly speak about them. The first one was autism identification and management from 0 to 14. Another was Georgian Journey to Functional Approach to Disability, which was maybe most important one, and I will speak about some details of this project. And spinal muscular atrophy treatment project recently was approved and launched during the last year. Why is so important to speak about this? Because in low middle income countries, there is low healthcare budget and many problems. So it's very difficult to choose between these many problems and identify most important one to struggle for governmental support. So how can we embark a journey if you do not know where you want to go? We begin first our project, and all these projects have its similarities and differences. From this retrospective analysis, we saw that most important is to have the family-centered approach, to have strong patient organization and strong professional organization, which must work hardly for raising awareness of media and society that struggle and press the government to have decision that is the main goal of the project or program and so on. First project was most difficult because we have no knowledge, it was pioneering. Second one was most important, early childhood intervention project, but we have very strong international support. And third one was maybe most easy because we have already quite a good experience with dealing with this. First project, when we begin, it was a difficult time, beginning of the 21st century. And you can see here that all the problems of global development, the delay and autism were not identified. Data from primary healthcare showed that there were not really problems. Autism was 0.04% only, and less than 1% was GDD. We all know that it's not real, and when we perform epidemiological survey, we found that GDD was as worldwide to this period, nearly more than 9%, and autism was 0.89, nearly 1%. That was common for this time worldwide. So we have, to this period, we have no professionals. The society was absolutely unaware of the autism problem, and there were no admissions with this compliance of the science of autism. And we begin from the 0 level, begin with raising public awareness with a lot of speeches in video, in TV, radio, playing videos, small social videos on TVs. We have the trainings, we collected the media representatives and have the training to aware them about the science of autism. And we helped parents to launch parents' organization. During this time, there was not so strong the social media, so everything is even more difficult. But we achieved our goal after 7 years of struggling, and in 2015, we began the first municipal project for diagnosis and managing of autism, and we have 300 beneficiaries in Tbilisi, municipally covered the costs, and nowadays it's spread all over the Georgia. We have more than 2,000 beneficiaries, and as you can see here, the budget was increased 10 times during last 7 years. Most important is a Georgia journey to functional approach to the disability, and it was how to develop early childhood intervention service. And we think about changes because there was very late identification of children at risk. It was mostly 3-4 years of age. There was a lot of cases of over and under diagnosis, over treatments with unnecessary drugs, or a lot of expensive investigations which were not really needed. There was no follow system, no screening tool, of course, not a sufficient number of services, and all this made the families very unsatisfied. Again, we found that these problems are very important. Newborn neurological problems and development delay were about 1/3 of admissions to the outpatient services. So they were very important to work with these problems. At this time, existing infrastructure was at primary level. There were no screening instruments. On secondary regional level, there were no services. We have one tertiary center with a multidisciplinary team approach, but of course it was not sufficient. So what we needed to build this system, to expand the knowledge, to implement valid screening tools, and we found that age and stage questionnaire 3 and social emotional was a very good tool. So we translated and performed research to adapt to cultural peculiarities of Georgia, and now it's working throughout all country, and we tried to build network of services. So the goal was to change medical approach to social, physician-centered to family-centered, and diagnostic approach to functional approach. Why we choose early childhood intervention? Because between many possibilities, because there was a worldwide experience, and the global survey showed us that nearly 100 countries were using successfully this project. I come. Oh no, I want to come back. Apologizes, but so it was very cheap one for poor country, quite a good and effective and relatively easy to spread throughout all Georgia. For best future of our children, we identified facilitators, barriers for our plan, and strengths for our country was that we have quite a good, ready for the changes legislation. We have parent baby book available for all parents, and also our association have quite a good web, Child G, of course not as good as Ken Child, but at least he has some information about development and neurodevelopment. In Georgia, there were 4 budget-funded programs partially covering and overlapping these problems, but they were not directed exactly to early childhood intervention. And we have the tertiary center who became the basement for building this new system. The most important maybe thing was the Coalition for Early Childhood Intervention, which was founded with the help of well-known expert in this field, Emily Vargas Baron from Rize Institute, United States, and she helped us. You know that everywhere and mostly in Georgia, it's very difficult to have many different organizations work together, not struggling with each other. And with the help of Emily and her leadership, we launched this coalition for early childhood intervention, in which more than 15 organizations working with children with disability work together, and we also organized and write the action plan, strategic plan for development of early childhood intervention, as well as action plan, which was step-by-step program for launching this service throughout Georgia. We also have no surveillance before, and we prepared the guideline for surveillance of development in primary care, which was based on screening with age and stage questionnaire, and it was obligatory to screen these children in all planned visits, and if we have the child at risk, then at 10 months, 18 months, and 24 months, they must be screened. And if even in one sphere we have low score, these children will be included in early childhood intervention without any diagnosis, and only after this they will be algorithm for diagnostic and for finding etiology and so on. We have, as everywhere, lack of services, lack of qualified professionals, lack of budget, and for covering all children needs. And also we have our cultural barriers, which included NGOs that were executing budget-funded programs were against changes. Also, policy and decision makers were lobbying the existing programs, and also they were very afraid of this new service, as they think that it must raise the budget for this service. But at last, in 2016, this early childhood intervention project was launched with all its positive signs, family centering, and working with the families and teaching them how to deal with the problems of the child. During the beginnings, we have this service only in Tbilisi and 5 big centers, cities in Georgia. But nowadays, in 2022, you can see that we have a lot of services, and nearly it covers all Georgia. We begin with, again, a little bit more than 300 beneficiaries, and now we have more than 2,000, and budget also increased more than 3 times during these 6 years. So now we have quite a good awareness of society, good screening tool, more or less good identification at primary, secondary level, and nearly all very good network of early childhood intervention services. Achievements of last years are that service is fully covered by state, beneficiaries are increasing in number, service quality is improving. Of course, it is still not perfect, and we change the rehabilitation approach and come to the functional thinking. And in this, Jenny and Peter, your influence and your effort is quite big. You helped us both to improve the quality and to change our approach, and we started setting SMART goals. Also, family participation is increased, but of course, it still needs to be strengthened. And last 5 years, we implemented ICF frame as well, and we think that it's a big achievement for us. Now we have more or less good primary, secondary, and third level, and we want to have also the very high level center 1 or 2 in Georgia with research capabilities also. Future steps will be advocate for early childhood intervention and of course improve program quality, and we are trying every year. And now part of our team was in Australia this year. Roslyn Botts hospital, and they have the new knowledge, and I think it will be very important for our country. And last few slides about the third successful project. It was a spinal muscular atrophy treatment. There was no treatment of this rare disorder till 2022. The plan was the same: Parents Organization, Rare Diseases Organization of Georgia, and our Association of Child Neurology and Neurosurgery, with the help of society and help of some other organizations and media. We begin working with government to have at least one drug available for treatment of this. We launched campaign Make Me Stronger, and the parents and patient organization was very strong. Professionals work a lot. They have a lot of speeches in TV, radio, everywhere. Social media was very effectively working. Patients have their histories, video histories in social media, which were very impressive. And they have a lot of meetings in different places and showing to people that they need to be treated. And media publications, a lot of media publications. And at last, in the end of 2022, added 5 million to budget for the treatment of risdiplam, the oral drug for spinal muscular atrophy. 2 minutes, I will show you 2-minute video with English subtitles about this campaign. There was no approved treatment and not registered any drug. And approval of Evrysdi give really hope to patients and parents. And this awareness campaign with video stories of these patients. This is a journalist to inform them about this disease. It was COVID period and a lot of virtual meetings with parliament members, with Ministry of the Health memorandum. This is our ex-Minister of Health who work strongly support this project. And at last, in November 2020, drug was approved. And from May of 2022, it became available for all patients, including those on palliative care. What we miss now, it's a multidisciplinary evaluation of program, newborn screening, and early identification of spinal muscular atrophy type 1, and these are our future goals. Thanks for the attention.
Thank you so much, Dr. Nana. That was really amazing. If you could stop sharing, please. I'm really out of speech. That was a really amazing job that shows what a big teamwork and team effort that you have put into this, and how that team effort changed into a very successful project. It's so amazing that you started from gathering evidences, and now you have reached into a series of successes starting from screening to intervention and family participation, which is, I'm sure, our dream. Like most of my colleagues here will share this dream, and that was really motivational. Dr. Nana, thank you so much for that great presentation. I will let the floor now for discussion, and I will let everyone join breakout groups. We will reserve our questions for Dr. Nana for the end, because I would like all team members to discuss around these issues, what political support we would like to gain to drive change in childhood disability, and share our experiences within our groups. And then we will share, we will appoint one spokesperson from each team member, and we will share our experience to the whole team by the end of the breakout session. So I'll give you about 20 minutes and randomly assign everyone to a breakout rooms. And then Dr. Nana, you will receive many questions by the end of the session.
The particularly interesting question is, what does Nana feel, and what do we all feel are the active ingredients? What, if we're going to start somewhere in trying to make change, where do we start? It's often with champions. First of all, people like Nana, and I suspect people like all of us who have a passion for this, but also how do we find people in government? How do we find people in the media who are interested in these issues, not just because that's their job, but often because they have a personal experience of disability? I've been to a president's palace exactly once, and that was in Tbilisi. And the reason that we were there is because the president of the country has a personal and family experience of disability. We don't wish anybody to have this, but if we can find the people who do, then maybe that's one of the places to start.
Yep. I think we had something similar discussion as well in our team. Jenny will share with us. But yeah, I agree with you, Professor Peter. Making it personal does help in overcoming the system barriers. Anything else the group would like to share? I'm sorry to assign Professor Peter as the group leader on my wheel. Okay.
It's the power of being in the chair, Selma-Ness. You can make Peter do speaking.
Jenny, you can share our team.
So group one, similar thing really, and we were talking very much because we had the extremes of quite small countries in our group and vast countries, because we had someone from China in our group, so a huge array, and saying we felt it was easier in a smaller scale where you could get to know the people in government and the people within power much easier, and that gives you that sort of a better chance to be able to make those changes. And perhaps how do you get over those hurdles in a bigger system, and certainly in a vast system like China? We were talking in some of our countries, there were other political things happening that were taking the agenda very much, and that was making it very difficult to make childhood disability far enough up people's lists. So that was quite a challenge. So some people had done some similar things to Nana. Everybody was hugely impressed with what Georgia and Nana have achieved. That came across, and there were some similarities and things that people were taking from that as well. So one of the things that we found quite difficult is having to repeat the same battles. So you get some funding for something, get something happening, and then when the government changes, you have to go through that whole process again. So you don't have the stability of fighting the battle once and then moving forward. So that, I think, sounded quite frustrating. And taking on board what Nana said about really gaining gathering that evidence to start with. So using that evidence then as your base to kind of carry your program and your ideas forward, really, and to make the case. And again, using media and social media as now something that's quite powerful in helping to do that. Yeah, anything else from our group? Anybody that I've forgotten?
Yeah, I think you've covered it
Okay,
all,
that's
Jamie.
us.
Yeah.
Thank you.
Group 2. If you have a spokesperson, that would be nice.
Maybe I can say a few words. I'm not sure I'm group 2 or 3. I'm don't know, but I want to say thanks all of you, and mostly the Jenny, because when Jenny comes to us and we change it, absolutely change it, our approaches in children with disability, and also I think that we changed their families, and it was also outcomes of these children, because with helping, and I appreciate very much what Jenny do for us. And if you have some passion, and if you want to achieve something, maybe you can do it inside with helping you, and then you can spread it in whole country. As Nana mentioned, we do it, I think, great job together. So thank you for everyone, and mostly Jenny, many thanks to you.
Thank you, Sophia, for sharing that. I'm also not sure, Sophia, which group you were in, but Sunanda, I know you are in group 2, so I'll give you the floor.
Okay, thank you.
Sunanda, you're muted.
Yes, we were in group 2, and of course, Dr. Sophia was leading the discussion. Dr. Ramla, Eliso, and I were in that group. We, in fact, discussed more or less, the points that Dr. Sophia covered as part of their work, and found that India being a very big country, one of the challenges we had was population and covering all that. And then Dr. Ramla, of course, spoke of, how they're trying to reach out. We realize there are not only knowledge gaps, and there's a lot of a need for information campaign to reach out to people who matter, as Professor Rosenbaum mentioned, even to reach out to the ministry officials and people in the media. It certainly, I think, we did not discuss, of course, that we should actually pick up people with lived-in experience, but it was like the political system challenges were covered by even Dr. Ramla, and we felt that training was very important, since we have to cover huge numbers, and if we have to do that, we felt, at least I felt, that primary care setting should be where we need to focus, which is at this point of time perhaps just beginning in India because of the attention to universal health coverage. But truly the surveillance and all are a problem here because there's no uniform system of identification and early intervention, and a lot of NGOs are working. And so some of these were covered, and maybe Dr. Ramla could also add to what I've said, because we were not noting down at that point of time.
You're muted.
You're muted, Dr. Ramla.
Hello, am I audible now?
Yes,
All right.
we can hear.
The additional things I wanted to say, in addition to the knowledge gap, is the treatment gap. Another thing is about the taboos that attach to many diseases in India. For example, when it comes to mental disorders or conditions like epilepsy, there are a lot of misconceptions also that exist. And all these have to be addressed right from the grassroots level. And another thing is, India being a large country, you find a lot of disparity between the states. Each state may be functioning like a separate country, and some states are as large as another country. So in states where the literacy is very high, it would be easier to approach, for example, the state of Kerala, which is in South India, rather than some other states where the level of literacy is very low, especially the female literacy. So all these are additional problems that we face.
Thank you so much, Dr. Ramla. Yeah, I think that's also a very important point. Yeah, the misconceptions and the taboos that you mentioned, they are great obstacles, especially in low resource setting areas like my country. I could say that I'm originally from Ethiopia, so that has been a big difficulty as well. Especially working with children with autism had been very challenging because they are thought of as being possessed by unwanted supernatural beliefs. So many families are not willing to bring forward their children, especially in the countryside. So we had many challenges in changing that system, and I share that with you, Dr. Ramla. So we know there are many challenges. So just bringing back our mind to solutions similar to what Dr. Nana has proposed. And at this point, Dr. Nana, you'll I hope you'll be able to give us more answers. So hearing from the group's discussion overall, there seems to be a theme of that working in a small group is more successful than having a larger system and dealing with the bigger system. And I was just wondering, how was that for you, Nana, working in Georgia? What is it, a small place, or is it? I'm not aware of the system and the population there, so you can share with us like how big of a system and how big of a challenge that was.
It's a small country, not big, and of course, as our colleagues from India mentioned, and Jenny also, that in big countries it's more difficult to organize people, to collect media representatives or parents or so on. In small country, it's more easier, and also in our country, nearly half of population is living in the capital of the country, in Tbilisi. So we can, it is more easy to have the parents' organization to communicate with them, and also to influence the government, because you will have some personal relationships and acquaintances with them. But in big countries, it's more difficult. But I think, as Peter mentioned and Arnab, that main thing is when you know what you want, you know what's the end point of your effort in this way, and you have knowledge, you have people who think like you, and then I think that you can achieve many things even in a poor country, which is our low middle income country, is Georgia nowadays.
Yeah.
I'm just aware, Salmanesh, we've had our hour, and it's been great, and we're all now we've got lots of things to say. So, do you want to just do a little wrap up and tell us about the next meeting?
Yeah. So everyone, feel free to reach out to Nana if you have any questions or anything you'd like to discuss. Feel free to reach out to us through our email as well. Our next meeting would be in March 2023, the last Tuesday of March. We will send out links and adverts prior to the next meeting, and we hope all of you will join us in that meeting. And we hope you will invite more participants to join our sessions. It was really great having you all here. Thank you so much for the great discussion and for sharing all those experiences with us. I'll take a picture, a screenshot of everyone. Smile.
Have to get the missing cameras on. Anna, your camera maybe.
Yeah. And I don't know if Mary is able to.
Mary wasn't, but
Yeah. I'll take the picture.
there's Anna. Great.
Oh, okay. I'll take another.
Take another.
Okay, great to have you all. Thank you so much, Nana, for that great motivational speech. So we hope to see you in March. Have a good day.
Thank you, Nana. Thank you, Selim
Bye.
Manesh.
Thank you
you.
all.
Bye. Thank you.
Bye.
Thank you.
Thank you all.
Bye.